the cardiologist and you're considering what are we going to do with this patient, it's an urgent matter, you could actually walk over to the cardiologist immediately, converse with him and get his feeling and feedback and relay that to the patient almost within minutes.
That's another advantage of the medical mall is when we need a consultation, we don't have to make a phone call. We don't have to wait for an appointment. We just take the patient, we walk them right down, and they'll fit them into the schedule for us.
I know one of the physicians here, again, Ken Cervoni, was talking about with the urgent care. Let's talk about that right now. You're going to have an urgent care center here.
Yes.
Run by Henry Ford, correct?
Correct.
And they're actually leasing from you.
Correct.
Okay, which is somewhat unusual. It would be the other way around usually. He was talking about, when something happens there, it can be an immediate referral. You cut out the waiting time, especially if you're talking broken bones or something.
Sure.
Time is of the essence. And, the concept is quite unique. Like we talked about, I don't even know if it exists anywhere else, certainly not in this immediate area that I'm aware of. Are you?
No.
Okay. And, with the hospital setting that's actually coming here, the urgent care facility, you're having an MRI unit here, you've got CAT scan. You're not doing surgeries here. You have dentistry here, Dr. Latcham and Dr. Van Wallen.
Exactly. And besides, may I point out, besides just CAT scan and MRI, we will have full diagnostics available. X-ray, ultrasounds, CAT scans, bone densities, mammography. We'll have the full service right in-house.
Rehab is done in multiple locations. I know the orthopedic group would be like shoulders. Dr. Femin, is going to have actually a back center
Correct.
here. You've got a lot of different specialties. A couple months ago we talked. You're putting up another building. About 41, 42,000?
Approximately 41, 42,000 on the same campus.
80% leased?
80%. We have interest in over 80% of it.
Already. They haven't even broke. I see a mound of dirt, but they haven't laid a footing, nothing. I mean, this is already.
Those were people, the majority of those people were people that were not able to get into this building because it was already sold out.
And you were somewhat selective. I mean, most of these physician groups you've had associations with over the years. You want to maintain that.
Yes.
Top-notch fellows. I mean, some of the top docs in the area.
Well, we did two things. Number one is most of the people were people that I've worked with for now 20 years. And every time we would put a new member in, I would announce it at a meeting for everybody's approval, because if there was something that I didn't know about somebody, then something that could be brought forward. So we had them, number one is most of the people I've been working with for over 20 years. And the other thing is, before I let anybody in, they also had to pass the approval of the existing members.
Let's rewind the tape. Let's go back when you first conceptualized this idea. First took that first pencil out, put it on a piece of paper, probably sweating and shaking. Didn't really know there's not much other environments like this that you compare it to. How was your process? How was your personal process through this whole method?
Well, I've been looking to build a building for, the better part of 13, 14 years. And it was just a combination of putting together the physicians, the property, the location, and then it started from there. Originally, this project has undergone, and we mentioned in the introduction, in tough economic times, this project has undergone 4 expansions. It would originally start off as an 80,000 square foot building, then 100,000 square feet, then 123, and now 160. And then now that is all sold out, and so now we're building later on this year or in the spring, we'll be building a second building to help accommodate the volume of physicians interested.
If nothing else, you've helped the pencil economy as well with all the erasing and the
absolutely.
It's been a good experience for you?
It's been very positive. Everybody from the township all the way down to all the trades, the bankers, contractors, engineers, architects, accounting, legal, everybody's been A+ on this project.
I'm looking through the window here. We're facing Shaner. There's a lot of businesses, potential lunch destinations. We've got the cafe here as well.
Yes.
This is something that 23 in Shaner, for everybody at home, something's happening here, something good is happening here, something's very unique is happening here. I'm a resident, like I said, of Shelby Township. I'm excited about this. It's going to be much easier to satisfy the needs of my family out of the Shelby Macomb Medical Mall. They're going to see us again. We're going to do pretty much a weekly, semi-weekly or a bi-weekly show on health, new trends, have a different specialty, different focus each week. And Dr. Antonio Tony Morreale, becoming my new best friend.
Why, thank you very much.
And we're very fortunate to have you.
Thank
a
you.
Man of your vision.
Thank you.
A lot of doctors share that vision, but you were the man. You were the brains behind this outfit. And before we go, it came up a little something. We got you pretty much, you have them covered at the Shelby Macomb Medical Mall from head to toe. You've got a podiatry up to psychiatry here.
Absolutely.
And most stops in between.
Yes, we do.
And for anybody interested, come on up. It's beautiful. Everybody knows there's a building here. Now they're going to know exactly what's going into this. This is just step one. We got step two, and who knows, with your vision, it could be 3, 4, and 5.
Why, thank you.
Antonio Morreale, this is the first show for 30 Minutes to Better Health. I couldn't have picked a better location, couldn't have picked a better topic. I appreciate you spending time out of your busy day, and we're going to see you again quite frequently, actually. And thanks for spending your day with us.
My pleasure.